In his book, Tired of Being Sick and Tired, Dr. Michael Berglund does a great job of addressing thyroid problems from a wellness approach, and it works. He also understands the adrenal glands and the symptoms of adrenal fatigue. Our production staff visited Dr. Berglund in his clinic. Here's what he had to say about adrenal fatigue.
Adrenal glands are your body's stress glands, and they release substances like epinephrine, which is also called adrenaline. They release substances that you may have heard called cortisol, some ones that you probably haven't heard of like aldosterone. The concern when these glands become underactive or insufficient is the problem we're going to discuss. I describe the adrenal glands kind of like if you had an emergency bank account. The idea behind an emergency bank account is we use this for when we really need it. The emergency bank account is there for emergencies. We're not supposed to dip into it every day. In fact, every day you might even put a deposit into that account. Withdrawals are only made for emergency purposes. The problem with adrenal fatigue is that we're constantly making withdrawals from our emergency bank account all the time. What someone looks like is panic. Anxiety can be part of the symptoms associated with adrenal fatigue. Now, that's not all it is. Sometimes it's a lot more confusing than that. The big one that I always see is moodiness. We'll see people that have a short fuse for crying, for getting angry, for getting frustrated. It can be with people, it can be with things, it can be with telemarketers, it can be a lot of different things. But the idea behind it is you know that you've had a longer fuse before. You could be provoked for a while before you get this angry, or you could be a worse situation before you go into crying. And now you notice that's just gotten worse. The other one that is really common is a mid-afternoon need to take a nap, or a collapse, that you start craving coffee to get through the rest of the day. That is extremely common with adrenal fatigue. The other adrenal fatigue ones that can go on is low blood pressure. Now usually this is someone who's been adrenally fatigued almost their whole life. They'll notice that they're always 100, 99, 94, 90 over 55, 50, 45 even. And so they tend to be very low blood pressure. If they stand up too quickly, this is a result of the low blood pressure, they'll get like a head rush sensation where they feel like they're going to pass out. Low blood sugar is often and commonly associated with adrenal fatigue. So we see that quite often. Adrenal fatigue people tend not to be good morning people. Now, there's some people that are morning people because they stay up really late at night, and they just, they aren't good morning people because they stay up too late. But there's a lot of people that they're just not good morning people. And you know those people because they take a long time before their brain starts kicking in, before you can have a conversation with them. They tend to be kind of grumpy in the morning, and they tend not to eat very well in the morning. Not eating very well is one of those things. Now you say, well, why would that matter? What's the whole, why don't they want to eat? Is it an appetite thing? No, it's actually a stomach acid thing. The stomach requires a lot of blood supply to be able to make hydrochloric acid. So any kind of heavy food or a lot of food requires a lot of gastric juices to be able to digest that food. If you don't have the gastric juices to do it, if you try and put an omelet in your stomach's going to want to refund it. You know what I mean by that, refunding. So the idea is they feel nauseous if they try and eat too much. Now they can have something simple like a half a banana or a bland piece of toast, but anything that gets kind of complicated, their body, and if it's too soon in the morning, their body will have a problem with that. So we need to allow adrenally fatigued people to get their blood flowing, get their blood pressure up, and get things circulated throughout their body, because their body will shunt it away from all the unnecessary parts. And believe it or not, the stomach, when it comes to survival, is an unnecessary part. So by now, some of you are probably watching this video saying, I think I have adrenal fatigue. If that's you, then here's what I'd like you to do. I want to give you some steps to take better care of yourself. First step is always get plenty of sleep. Now, all the doctors always say that, but you do need to get plenty of sleep. If you're trying to get 4 hours of sleep a night and think you can feel well, then you can't. But the other steps are proper diet. Now, proper diet is not, what doctors say proper diet. Proper diet for you is going to probably be to make sure that you do protein at each meal, You're avoiding the sugary things. You're avoiding a lot of the starches and the complex carbohydrates that a lot of people think are healthy for them. I tell people you do want some protein. You do even want some fats in your meals to balance out the blood sugar reaction that you're going to have. Caffeine can be a really negative thing for a lot of adrenally fatigued people. So I have people avoid caffeine because basically caffeine pulls adrenaline out of your adrenal glands for today. The problem with that is you are already depleted in your emergency account, remember, and you're making withdrawals when you should actually be making deposits. I've helped thousands of people overcome adrenal fatigue, and the common theme they have is they go, I just feel human again. The simple things in life they can handle where they couldn't handle them before. It's an effective treatment protocol for anyone who's on a path toward wellness.
Exhausted adrenal glands are more common than you'd think, and healing your adrenal glands could not only balance you and get you back on track, it could be life-changing. Contact your wellness professional. Ask about adrenal fatigue, a natural, safe, nutritional approach to health. It just makes sense.